Hello, nurses. This is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. This is cardiac lecture number 37. What I'm covering today is DVT, deep vein thrombosis, and a PE to pave the way. Okay, I can be found on social media, Instagram, Facebook, Pinterest, Etsy, and nursingkamp.com. And today's sticky note I'm covering is this one that can be found on social media. Okay, here we go. The first thing is with the DVT or pulmonary embolism is that there's a clot. And that clot is the result of Virchow's triad. And what I mean by Virchow's triad is the three things that could cause a clot. And those are hypercoagulability, and what I mean by that is in AFib, for example, there's no P wave. So the atria is just fibrillating. And what happens is that increases hypercoagulability. And they're more likely to have a clot that could then lodge in their lungs or in their brain. Another hypercoagulability would be dehydration. Because the viscosity of the blood is highly concentrated. Also, stasis, another reason. Stasis is immobility, sitting in bed too long. That's why we get our patients up and stop moving. Because by doing that, they don't have stasis because the risk is they could throw a clot. So hypercoagulability, stasis, and then trauma. Any kind of surgery or trauma, you're more likely to have these microemboli that could get lodged in the veins. And when they're lodged in the veins, the problem with that is that they're just sitting there and they're ticking time bombs. Because the venous system basically has valves. And those valves close and open. So when somebody is sitting down for a long period of time, and they're compressing this venous system. And that's why they want people to get up and move, especially in like airplanes and different things like that, because in airplanes, if they're sitting for a long period of time, and then when they move, this clot can go up into their heart, into their lungs, or up to their brain. And that's problematic. So let's talk a little bit about the findings of DVT. Well, the big thing is, what's the difference between DVT and a PE? Well, vein thrombosis means staying put. So the clot is stuck. And embolism means moving. Okay? So thrombosis is stuck and embolism is moving. That's the difference. And with a PE, when it's lodged, it's been moving. Okay? Right. So the next thing is we're going to talk about some symptoms. And this is called CHOOSE. Some symptoms are calf pain. Because as that clot is stuck in the calf, in the location, they'll start to have some pain. They also might have what's called a positive Homan sign. Now, this is there's a lot of debate about this Homan sign, because the thing is, the patient could have it, they could not have it. It's not inclusive. So what it is that you put the foot forward and back, and if there's pain, that's a positive Homan sign. That means there might be a clot or not. NCLEX, it still kind of tests on that, though it's not the standard. Next thing is erythemia. So as that clot is stuck, it starts to get red, and there starts to be a problem, and you start to see this erythemia in the location. And it starts to get warm, and then it starts to swell. So calf pain, positive Homan sign, erythemia, warmth, and swelling are all signs of a DVT. The next thing we're going to talk about is what do we do? So some things that we can do is breathe, and that is bed rest. So initially, because we know that the clot is there, so what we do is that we don't want them moving because we know they have one. So they're sitting there in the bed, and we they have a DVT. So we want them to sit there in bed rest. We don't want them moving because that clot could mobilize and become a PE. We elevate. We may elevate, depending. And anticipate anticoagulants like heparin or Lovenox or even a heparin drip. What else? Might get some Tylenol for pain, NSAIDs, heparin, which I just said, and SCDs. Now, SCDs you see a lot. If a patient is immobilized and they're on bed rest, we generally will order SCDs, and those are sequential TEDs, right? Sequential things that you put on the bottom of the legs, and they're hooked up to a little machine that then pumps and provides blood flow to a person that, so it's kind of like how you are walking, and that's kind of what sequential TEDs do. All right, so some other things to know about it. So when a person comes in and they have these symptoms, they might do what's called a D-dimer. D-dimer ACE. A D-dimer is a specific test that is going to evaluate whether or not, and that needs to be, if it's less than 400, it's not positive. And what does it mean? Well, in D-dimer is whenever there's a clot in the venous system, D-dimerase, this enzyme, gets secreted to try to break down that clot. And so when it's being secreted and you draw a blood sample and you get a positive D-dimer, it says that there's a clot somewhere in the body. Now that's not absolute, but it is still a test that is done to rule out whether or not. Okay, but ultimately you'll do an ultrasound of that leg to see whether or not there is a clot. But a D-dimer is a test, a lab test that we do. Okay. So what's some things that we do for medication-wise? Well, the first line is that you're going to monitor the 4 Ps. And those 4 Ps are your PT, your PTT, and your platelets. And if you're unfamiliar with this is in my other lecture, coagulation, fishbone. So please see that. Now, platelets, because of all bleeding, these are all bleeding, because you're going to be giving them anticoagulants, heparin. And look at my heparin lecture where I discuss that more importantly. Pulses too, because you're going to be monitoring for peripheral pulses. So the patient's at risk for bleeding because you're giving them anticoagulants. And the post-teaching for this is that they might be on anticoagulants for a period of 5 days. They might be on some Lovenox at home. And please see my lecture on that. Okay, so a quick recap. DVT is a thrombosis that is stuck in the venous system. It hasn't mobilized yet, like with a PE, a pulmonary embolism. And so what you're doing is that it's a ticking time bomb. It's in the venous structure, and you need to start treating quickly, because the thing is that you do not want it to go to the brain and get lodged up there, or into the lungs and get lodged into the lungs and become a PE, which is my next lecture where I cover pulmonary embolism. All right, my name is Camp, and this is Nursing Camp, and this is my lecture on DVTs. I can be found on social media. It's from this sticky note that can be found in Nursing Camp, and we'll see you next time.